Injex is injection without a needle. Needle-free means a safer and less painful application. Injex allows you to deliver and inject individual doses of insulin while remaining particularly gentle to your skin. The reusable injector can be used for a minimum of 7,000 injections. Apart from the injector, the system consists of the following components: the reset box, which recharges the injector's spring and also serves as a handy carrying case, the sterile disposable ampules for insulin, sterile adapters, the transporter which transfers insulin from pen cartridges to the disposable ampule, and a carrying bag. Depending on the type of receptacle your insulin comes in, you may need to select either the transporter with the transporter adapter, the vial adapter, or the pen adapter for your needle-free injection. Using the pen adapter to fill the Injex ampule with insulin from pen cartridges. Take your pen and insert the pen cartridge as usual. Please observe the instruction manual for your pen, particularly the section on venting. Screw the closed pen adapter onto the thread of your pen and open the cap of the pen adapter. Now remove the Injex ampule from its sterile packaging. Move the plunger to loosen it and insert it completely into the ampule. Screw the Injex ampule as far as possible into the adapter. Fill the Injex ampule by setting the required units on the pen as usual. Press the trigger of the pen, keeping it pressed for a few seconds. Using the vial adapter to fill the Injex ampule with insulin from vials. To fill the Injex ampule from vials, take a vial adapter from its sterile packaging. Remove the protective cap of the vial and pierce the rubber seal of the vial. Make sure the vial adapter is firmly in place. Now take an Injex ampule from its sterile packaging and pull the plunger of the ampule out about halfway. Open the cap of the vial adapter and screw the Injex ampule as far as possible into the adapter. Turn the vial and ampule over and push the plunger of the ampule all the way into the Injex ampule. Now pull the plunger of the ampule back slowly until the desired dose has been drawn up. Using the transporter and the transporter adapter to fill the Injex ampule with insulin from pen or cylinder cartridges. To fill the Injex ampule from pen and cylinder cartridges, take a transporter adapter from its sterile packaging. Take the transporter and turn the green handle until the pen or cylinder cartridge can be placed into the transporter chamber. In order to safely position the cartridge, turn the green handle until contact is made with the rubber seal of the cartridge. Screw the transporter adapter onto the transporter, whereby the needle of the adapter must penetrate the rubber seal of the cartridge. Now take an Injex ampule from its sterile packaging. Open the cap of the transporter adapter and screw the Injex ampule as far as possible into the adapter. Turn the handle of the transporter until the Injex ampule contains the desired dose of the drug. Here's a tip. After filling the Injex ampule, turn the handle of the transporter backward a bit so that the internal plunger does not apply pressure to the rubber seal of the cartridge. This prevents a leakage of insulin. Administrating insulin with Injex. Take the secured and charged injector from the reset box. Now screw the filled Injex ampule as far as possible onto the big opening at the end of the injector. The final turn will be a bit harder to complete. Push the green safety ring forward to the safe off position. Now the injector is ready for use. Press the injector onto the injection site vertically until skin is clearly dented. Activate the trigger mechanism and continue to hold the injector firmly in place on the injection site for 2 or 3 seconds after activation. Screw the Injex ampule off the injector and discard it. Push the green safety ring backward to the safe position. Place the secured injector into the reset box and close the cover. This recharges the injector, and it is then ready for the next application. Injex, the needle-free injection system, is ideal for all those who do not wish to inject with a needle on a daily basis. Injex is less painful because it is needle-free. Injex guarantees the safe administration of individual units of insulin. And with Injex, injections are particularly gentle to your skin. Injex improves your quality of life. Please ask your physician or your diabetes assistant for more information on Injex.